And these are the props I'm going to use. When people think of the nutrients needed to make bones strong and healthy, they often think of calcium and phosphorus. An important nutrient people often forget about when it comes to the sound formation of teeth and bones is fluoride. Tooth formation begins in utero, and fluoride is essential for this process to happen. According to Dr. Esther M. Wilkins, fluoride is available to the developing tooth by way of blood plasma to the tissues surrounded by the tooth buds. The tooth becomes mineralized when the hydroxyapatite crystallines, calcium and phosphorus, structure becomes fluorapatite crystallines, which is the adding of fluoride to calcium and phosphorus. After mineralization is complete and before eruption, the maturation stage occurs. The maturation stage is when fluoride deposition continues in the surface of the enamel. After tooth eruption and through the lifespan of the tooth, fluoride can come from many different sources. Fluoride can come from drinking water, dentifrices, which is toothpaste, and mouth rinses. In dental offices, there is an increase of percentage of fluoride intake can be applied every 4 to 6 months needed due to the patient's condition. Professional use of fluoride is indicated for the prevention of dental caries, the remineralization of demineralized areas, and desensitization. Demineralized areas are when they lack calcium, phosphorus, or fluoride, and is the initial stage of a cavity. I brought some props here. This is the 2% sodium fluoride that is used in a dental setting, or we have the 1.23 that is bubblegum flavored, which is often used for a child. And these both are used in the dental setting. This is a gel and this is a foam. And we have different trays that we apply these in. This is a child tray. It's a little bit smaller. This is a normal adult sized tray. And this is for usually a man or somebody with third molars. And so I'm just going to show you here what we do. We apply a thin layer around the inside of this tray. And then we insert this tray into the mouth, and the patient chops up and down for 4 minutes. We ask the patient not to eat or drink anything for a half an hour, and not to try to brush until 4 to 6 hours after, just so the fluoride can stay on the teeth a little bit longer. We also have a fluoride varnish, which is 5%, and the fluoride varnish is a little bit stickier, but it's just it's just painted on your teeth, kind of like a nail polish, I guess. And the reason for this, it's good because it has quite a bit more than the others. It's 5%. And also it's used in desensitizing. Concentration of fluoride is greatest on the surface, next to where the fluoride is being applied. For instance, when using a toothpaste, mouth rinse, or professional application, the fluoride is applied to the enamel layer and where it is absorbed. So like that, we are putting on the teeth itself, which is the enamel layer, which is the tooth crown. This prevents sensitivity when the tooth root is exposed. The fluoride is absorbed to the root and blocks the sensitivity. The fluoride is consistently being released for uptake. Fluoride was named by the United States Center of Disease Control and Prevention as one of the 10 most important public health measures of the 20th century. The 3 basic topical effects of fluoride to prevent dental caries, according to Wilkins, include inhibit demineralization, enhance remineralization of incipient lesions, and inhibit bacterial activity by inhibiting enolase, an enzyme needed by bacteria to metabolize carbohydrates. Fluoride is efficient, effective, and inexpensive. And it's very important to use to improve and maintain the oral health. Fluoride is also found in food. It's much founded in tea and fish. There is not much found in meat, eggs, or veggies. However, there is some. Food, when cooked in water, absorbs the fluoride from the water. Fluoride can also be found in salt. In the United States, it's not popular, however, but it has been proven to lower the incidence of dental caries. And the recommended fluoride levels are 0.7 to 1.2 parts per million, and according to the Fort Dodge Water Department, the fluoride level was detected here as 0.88 parts per million, so we're right in the average there. Dental caries is the most common disease found in adults and children. Fluoride is a great tool to reduce the bacterial load and to prevent dental caries. The recommended 8 glasses of 8 ounces of water a day can help prevent this disease. So next time you go to the dentist, you might want to think about receiving one of these, and also drink water.